How do you know if you're depressed? That's what I'm going to talk about in this video. Stay tuned. I'm Dr. Tracy Marks, a psychiatrist, and I talk about mental health and self-improvement. If that's up your alley, then just click subscribe. This is what clinicians use to diagnose mental disorders. It's called the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It's our textbook. So even though we don't have blood tests to diagnose or to prove that you're depressed, it's still not a matter of guesswork. There's a cluster of symptoms that are associated with being depressed. In order to be diagnosed with depression, you must have 5 of the following symptoms for at least 2 weeks. Also, all of these symptoms are present at least most of the day and present almost every single day. So they're just not fleeting. So you must have 5 of the 9. First, we have a depressed mood. People may say they feel sad, hopeless, or even empty. In children and adolescents, they can be more irritable than what you would expect just from regular childhood upset or being a moody teenager. A second symptom is being unable to enjoy anything. We call this anhedonia. So things that you used to enjoy, you just don't get any pleasure out of anymore. Then there's weight loss or a weight gain of 5% or a decrease in or increase in appetite. Insomnia or hypersomnia. And insomnia would be trouble falling or staying asleep, and then usually sleeping only less than 5 hours. Hypersomnia would be sleeping more than 10 hours. And this could be continuous, or it could be a total of your nightly sleep plus your naps. A 5th symptom is being slowed or restless. I've had some patients tell me they can tell when their depression is coming on because they feel their limbs getting really heavy. Another symptom is being tired or having low energy all day. Then there's feeling worthless or having excessive guilty feelings. You can have trouble thinking or concentrating and making decisions. Depression is a huge disruptor of your ability to concentrate and focus. And if you can't focus or pay attention, you will have trouble remembering things. So therefore, depression can also cause memory problems. And then we have thinking about death or thinking about killing yourself. Depression can really distort your perception about your future. Things can look really bleak and get to the point where you just want to end the pain. And there's a difference between passive suicidality and active suicidality. And here's an example. Suppose you were crossing the street and you thought, if a car came and hit me right now, I'd be fine with that. That's passive suicidality. You don't have a plan or intention of ending your life, but the prospect of doing something or having someone kill you is an attractive option for you. People become actively suicidal when they start formulating a plan in their head, even though at the moment they're holding back from acting on it. Active suicidality is an emergency and should be treated in a hospital or crisis center setting where the person can be in a safe environment until they're more stable. Here are some symptoms that I commonly see that don't fit neatly onto the list that I just gave you. And these would be things like feeling like everything is hard. And this is how you can end up not getting anything done. You just can't bring yourself to attend to tasks. There's also frequent crying. You can have a short fuse all the time that makes you very irritable or easily angered. As you can see, there's a lot of symptoms. But one important question we have to answer is, how much is this or are all these symptoms affecting your life? Another way of putting it is, how much dysfunction does this really cause? One person can have several of the listed symptoms, but they're still going to work each day and they're still participating in social activities, but they don't feel happy inside. They go to these social things, they put on a fake smile, but yet feel very empty while they're there. Then there's another person who may have trouble getting out of bed, not going to work, and some people even stop bathing. And this is the person who's probably not going to pull out of this without some sort of professional help. whereas the first person may be able to slog through without any kind of treatment, and then the symptoms eventually pass. Now, when I say treatment, I'm talking about either therapy and or medication, and I'll have more about treatments in other videos. So that's it for now. Thanks for watching, and don't forget to subscribe.